Now, a coronavirus special report. While we still don't know the long-term impacts of COVID-19, tonight we are hearing from a young, once healthy Mobile woman who doctors are calling a long hauler.
She shares the story of her grueling and uncertain recovery process with our Brianna Hollis.
Emily Esposito is 27 years old. This is her a few weeks before she got diagnosed. She ran the Disney 10K, and this is her shortly after, hooked up to a breathing machine in the hospital. She's out now, but still nowhere near back to normal.
Was that I was one of many that they're seeing that they're calling long haulers.
Emily Esposito and Kyle Moore were supposed to get married on October 10th. 2020 was supposed to be their year. They're outgoing and adventurous, each other's workout buddies.
I was a healthy 27-year-old who was running every day and was working all the time and just kind of enjoying everything, and that all came to a huge halt.
Now, even mundane everyday tasks can tire Emily out.
7 months into it, at this point, I'm walking okay, going to PT. Some days are better than others. Talking is hard, but not as hard as it used to be.
She was given a presumptive positive diagnosis back in March, but with little knowledge about the virus altogether, that's all she could get.
He basically said, we only have 6 tests. We're saving it for people who are autoimmune deficient or anything like that, or older.
On paper, she didn't meet the medical criteria, while her symptoms said otherwise.
By that Thursday, I couldn't even sit up in bed. I couldn't hold a water bottle. Kyle had to do literally everything.
She got admitted to the ER the next day, but it was a short stint.
When I was discharged, they were basically like, you're not totally dying, and you're under 65, and we don't know what else to do, and we're running out of space.
She finally got her first test in April. It came back positive. Some days she could barely move. Her short-term memory was failing. A whole month later, no relief. She tried going back to the hospital, but again, she was told she just wasn't sick enough.
That's when they wouldn't admit you. They said, if you're not dying, we can't admit you.
So at the end of May, Kyle drove her to UAB, where she was admitted on the spot. Then came a moment that the couple thought might be Emily's last.
All of a sudden, my body completely froze. I couldn't move any part of my body, and I couldn't breathe. I do remember the doctors rushing in. I couldn't move my arms or legs. My heart rate was, out of control.
It's tough to see someone you love that you can't do anything for.
The bottom of her lung collapsed on May 20th. Her case required research doctors, so they eventually headed to the Mayo Clinic in Jacksonville. Well, they kept her for a month straight between July and August, and she still has monthly visits.
I've kind of become a little bit of a case study for them, and they're starting to see more and more patients like me.
When she's not there, she gets to see bits and pieces of normalcy. It's just interrupted by her losing her breath in the middle of a sentence or a lapse in memory.
I don't think this is something we're ever going to put behind me. I think this is now just become a part of life.
The couple is adjusting to this new normal.
To work with my doctors, work with physical therapy, and just try to continue to build my lungs and strengthen my body back up.
Each day, embracing the little victories and looking ahead to their new wedding date, October 9th, 2021. She said the mental and emotional side of this was just as trying as all of the physical symptoms, so she's encouraging anyone else who may have an extreme case of COVID-19 to make sure to prioritize your mental health throughout this entire process. In the studio, Brianna Hollis, WKRG.